Hi, everyone. I'm just going to give it a few minutes as people are filtering in before we get started. Again, we'll just give it a moment to make sure people have the chance to filter in. All right. Welcome to the session this morning, which is Introduction to Dementia Communication with Ava Keese from the Alzheimer's Society. My name is Micheline McWhirter, and I'm the project manager at the Village at Canada College, and my pronouns are her, she. Before we begin, I'm going to go over a few housekeeping items. So this is webinar style, which means that we can't see you. As facilitators, we can't see you. The cameras are not on and we can't see who is present other than your name. So during the session, if you have any questions about the technology, if you're having technical issues, please type into the chat box, which you see as an option at the bottom of your screen. It's in the form of a sort of a circle, I guess. I don't know how to describe that. I'm really bad at describing that. So you can chat, you can type your question there. Kelsey, who appears as Josh, actually on the as a panelist, is monitoring the chat. If you have any questions for our presenter about the session, you can submit them through the Q&A box at the bottom or through the chat. Also, you can also raise your hand. There's a raise hand function, which is a hand icon. If you click on that, then Kelsey is able to unmute your mic so you can ask the question. Ava has said that she is completely comfortable with people asking questions throughout the presentation, so you do not have to wait to the end. So if something comes to you, please don't hesitate to just put that in the chat box and we will answer them as they come in. The session is being recorded and will be made available at a later date online through the Stay on Your Feet website. The other thing that I want to start with today's session with is I want to acknowledge that we are hosting today's session on land that has been inhabited by Indigenous people since time immemorial. The Nipissing Parry Sound District sits on the traditional territory of the Anishinaabe people and within the lands protected by the Robinson-Huron Treaty of 1850. We acknowledge that we are also situated on unceded territory of the Algonquin Nation and settlement of the Métis Nation. As individuals and as organizations, we are dedicated to honoring Indigenous history and culture and committed to moving forward in the spirit of reconciliation and respect with all First Nation, Métis, and Inuit people. This session, as I mentioned, is being presented by Ava Keese, who is a public education and health promotion facilitator with the Sudbury, Manitoulin, North Bay and District Alzheimer's Society, which is based out of North Bay. Ava offers education and training for the community's general public, healthcare providers, first responders, care partners, family members, and for people living with Alzheimer's disease and related dementias. So if you do have a need or want to have presentations, this is you're able to reach out to Ava about this. So for a complete bio, you can check out our website, which is the myhealthunit.ca/SOYF, which stands for Stay on Your Feet. And I want to thank Ava for joining us. And without further ado, I'm going to hand it over to you, Ava. Now, we do have one poll just to get to know people in the audience a little bit. So Kelsey, if you're able to run that poll for us. So this is our only poll for this session. So have you supported somebody with cognitive issues? Have you supported somebody who has dementia or Alzheimer's? You can just pick using your mouse. You can pick a yes or no answer here, and this helps Ava get to know who's in the group today. Oh, and thank you to Lacha for giving me the right word. It's a speech bubble. the icon that appears when you move your cursor. Thank you for that. I always appreciate when the crowd helps me out.
All right, well, we've hit most of our quota here, so I'm going to end the poll and I'll share.
All right. So we have about 63% of people who have supported someone, and we have other people who have not yet, about 38% of the group. So now it's officially over to you.
Right.
And yeah, thank you, Latja. We're here for each other. Thank goodness, because this technology thing is really tough, I have to admit. Thank you again.
All right, well, thank you for the introduction. Welcome, and thank you everyone for joining me in this presentation today. As Michelin mentioned, I'm Ava, and I'm the Public Education and Health Promotion Facilitator with the Alzheimer's Society based out of North Bay. Today, I'm going to be presenting to you the Introduction to Dementia and Communication. By the end of this presentation, you'll have received an Introduction to Dementia, communication strategies and tools for engaging with people living with dementia, and a brief overview of our services that we provide here at the Alzheimer's Society. So as mentioned again, feel free to ask questions as we go. If I don't have an answer to your question right away, I will talk with my colleagues about it, and I will find a way to get that information back to you. So we are going to begin with a basic overview of dementia. I'm wondering if anyone here knows the difference between Alzheimer's disease and dementia.
That's a great question. We can actually, if somebody raises their hand, if somebody's like, pick me, if somebody's willing to raise their hand on this, Kelsey can unmute you. And nobody's responded, so Ava, it's over to you.
That's all right. So dementia is actually an umbrella term that describes a wide range of symptoms that are caused by disorders affecting the brain. So almost 40% of people over the age of 65 experience some form of age-associated memory impairment. However, dementia is not a part of normal aging. People living with dementia experience memory loss that is severe to the point where difficulties with thinking, problem solving, and language are severe enough to reduce the individual's ability to perform everyday activities and carry out a normal routine. The person living with dementia will also experience both short and long-term memory loss. Short-term memory loss is usually experienced in the early stages of dementia, whereas long-term memory comes into effect near the middle to late stages. The person living with dementia will experience difficulty both in learning new things as well as completing familiar tasks. And the person living with dementia will also experience changes in mood, behavior, and personality characteristics. So there are actually over 100 different types of dementia. You can think of dementia like the term cancer. So it's the classification that determines the symptoms that the individual experiencing this disease may appear with, as well as available treatment options, etc. So obviously, I will not be covering all 100 different types of dementia today. We are just going to be reviewing the most common types, which are shown on the slide in front of you. So first and foremost, we have Alzheimer's disease, and it makes up for 60 to 80% of dementia cases, hence why we call ourselves the Alzheimer's Society. Alzheimer's disease is characterized by slow declining effects that typically last anywhere from 8 to 10 years. This decline is present in all aspects of a person's life, including how they think, feel, and act, and it progresses as if it was a slope, so gradual and consistently. However, each person will be affected differently, but there are some warning signs that you can look out for. So there are cognitive and functional abilities that will be affected, including the person's ability to understand, think, remember, and communicate, thus impacting the person's ability to make decisions, perform simple day-to-day tasks, and follow conversations. Sometimes they may lose their way or experience confusion and memory loss. For emotions and moods, these are often expressed through a loss of interest, and seemingly they will be less expressive or seem withdrawn. Their physical abilities will be affected by means of coordination and mobility, to the point that their ability to perform day-to-day tasks such as eating, bathing, getting dressed, and toileting will need to be assisted. As well, there are behavioral changes, and these include reactions that may seem out of character, such as repeating the same word or actions, hiding possessions, physical outbursts, and restlessness. We like to term these responsive behaviors rather than problematic behaviors, because when they are addressed as problematic behaviors, you are automatically assuming that something is wrong with the person expressing these behaviors, whereas it is actually much more complicated than that, and there's much more to it to understand why these behaviors are being expressed. And if you tune into my presentation tomorrow at this same time, we will be going more into depth about these behavioral changes. Secondly, we have vascular dementia. It makes up for about 20% of the cases. And this dementia is onset when the vascular system fails to provide enough blood to the brain, which causes cells to become deprived of oxygen and eventually terminate. This dementia is most often a result of stroke. However, having a stroke does not mean that you will develop dementia. It just means you are at a higher risk of this particular vascular dementia. The same can be said about brain hemorrhages or concussions. It all depends on the brain's ability to recover. Progression of vascular dementia can be anywhere between 3 to 30 years, and this is because of its progression characteristic. So unlike Alzheimer's disease and other forms of dementia, vascular dementia progresses like a staircase, where symptoms may deteriorate rapidly and then remain stable for a significant period of time before declining again. Typical symptoms developed in vascular dementia include changes in the ability to make decisions, plan, or organize, and difficulties with movement, such as slow gait and poor balance. Next, there's Lewy body dementia. And this dementia makes up anywhere from about 5 to 15% of dementia cases. And it occurs when abnormal protein deposits called Lewy bodies develop inside the brain's nerve cells. And what happens is this buildup of Lewy bodies blocks messages between the brain cells in areas that regulate behavior, cognition, and movement. So this dementia actually mimics Parkinson's disease, such as tremors, body stiffness, and shuffling of the feet. And those with Parkinson's disease are at a greater risk of developing Lewy body dementia. Those with Lewy body dementia also commonly experience a progressive loss of memory, language, and reasoning, and they may see an onset of depression and/or anxiety, as well as they may suffer from visual spatial disorientation, so hallucinations and paranoia. So for visual hallucinations, this is seeing things that aren't real, and this is often most common in times of increased confusion. They are often reoccurrent and consist of people, children, or animals. They may also experience paranoia, so psychotic and fixed false beliefs, and making errors in perception. So for example, something as seeing faces in carpet patterns, or believing something as such as your personal possessions have been stolen from you, even though they have just been misplaced. And lastly, there's frontotemporal dementia, and this is responsible for 2 to 5% of dementia cases, and it primarily affects the frontal near the forehead and the temporal near the ear regions of the brain. The frontal lobe regulates critical judgment and is considered the filter of the brain. The temporal lobe is responsible for regulating language and communication. So unlike Alzheimer's disease, people with frontotemporal dementia won't experience the memory loss and confusion of time in the early stages. Instead, they're going to experience significant behavioral and personality changes because of this loss of the filter in the frontotemporal regions. So they may be saying inappropriate things during inappropriate times. And because of this, the changes in behavior and communication abilities, it is one of the most difficult dementias for the care partners and family members. So for example, if you go out into public, say you are at a restaurant and you have an issue with the server, you would be able to keep those comments to yourself, whereas somebody living with frontotemporal dementia would be very quick to let them know their actual opinion of that individual. So it tends to be more isolating because these individuals have a more difficult time with appropriate public reactions. Further, there's also mixed dementia, which is exactly as it sounds. Some people may be living with more than one form of dementia at a time. And in these cases, it's often Alzheimer's disease and vascular dementia. And lastly, we have young onset dementia. So unfortunately, dementia is often considered an old person's disease, but there are actually 2 to 8% of dementia cases are considered young onset, which is anyone diagnosed with dementia under the age of 65. And this applies to all types of dementia. So if you are diagnosed with this, for example, you would be diagnosed with young onset Alzheimer's disease. And this type of dementia actually progresses at a much quicker rate of about 6 years. The youngest case that we had at our society was actually a lady living with young onset Alzheimer's disease, and she was at the age of 37. Before I move on, are there any questions about the different types of dementia? I see that
we have
Susan
a hand
raised-
up.
Yeah.
So Susan, I'm going to give you the ability to talk. So once I click on this, it'll ask you to unmute.
I'm curious about how you diagnose the difference between these types of dementia. You know, it is an umbrella. Like, how can you say specifically that someone has Alzheimer's? Is there a special test for it? How do people diagnose it?
That's a great question, and it is a very difficult process. It is meant to be a difficult process because you want to make sure that you cancel out any other possibilities that may be causing these symptoms. And we are actually going to cover this further on in the presentation. So thank you for that. Are there any other questions before I move on? Okay, so next we are going to discuss the characteristics of dementia. So the first characteristic is this disease is degenerative. So while the affected areas of the brain will differentiate depending on what dementia the person living with dementia is living with, it is important to understand that dementia is a brain disorder, meaning that the cells within the brain that are affected are being broken down and are eventually dying. So while this cause is unknown, there are two culprits. Unfortunately, these cannot be completely confirmed until post-mortem, but they have found in the brain plaques that form between the brain cells and have toxic effects on their function, as well as tangles that are formed when microtubules collapse and prevent the transportation of necessary nutrients to the cells, leading to the cell death. I would like to mention that there is also no genetic component proven to be attached to Alzheimer's or any type of dementia. This is often a question that we get, and it is often misunderstood by the public. So again, there is no confirmed cause for this disease. And we are going to be watching a video that explains this degenerative characteristic shortly. Second, this disease is progressive. So symptoms associated with dementia are eventually going to worsen over time. And usually this process is gradual. However, unless the person is diagnosed with vascular dementia, as we had mentioned earlier, and it progresses more as a staircase where they decline significantly in a short period of time and then remain stable. It is important to note that each experience that is living with dementia, they will have their own unique journey. So we like to say, if you've met somebody living with dementia, you've only met one person living with dementia. The symptoms that an individual experiences and when they experience them are going to be different for every individual living with this disease. And finally, and unfortunately, this disease is irreversible. So once a cell in the brain dies, it cannot be repaired. And there is no cure for dementia. So all individuals living with dementia, unfortunately, will eventually lose the ability to perform bodily functions that are necessary for survival. And this is because as the brain cells die, they are no longer able to communicate to other vital organs in the body to perform functions such as the ability to swallow, breathe, and pump oxygen to the heart. So it's important to recognize that the brain is the most vital organ in the body, and without its full functionality, the individual will eventually not be able to perform internally properly. So we are about to watch this video that I have on the progression of dementia. It is specific to Alzheimer's disease. And while this video is a great source of knowledge, progression is discussed as if it is a linear process. So please keep in mind, as we just mentioned, that progression is going to be different from one person living with dementia to the next. However, there are going to be specific stages that each person living with dementia will go through. The first stage, or the early stage, refers to any individual who has mild impairment due to their symptoms. The common symptoms are forgetfulness, communication difficulties, and changes in mood and behavior. People in this stage usually retain their functional capabilities and require minimal assistance. And then they move on to the middle stage. And this brings a greater decline in the person's cognitive and functional abilities. Memory and other cognitive abilities will continue to deteriorate, but they may still have some awareness of their condition. Assistance with daily tasks will eventually become necessary, and each person within the care team at this point will need additional help and support. So this means both the person living with dementia as well as their care provider. And then we move into the late stage, and this can be called either severe or advanced. And in this stage, the person eventually becomes unable to communicate verbally or look after themselves, and care is required 24 hours of the day. And at this point, the goal of care is to continue to support the person to ensure that they're living the highest quality of life possible. So I will play the video now.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So I'm just going to double check and make sure that nobody has any questions involving the progression of the disease before we move on. Okay, I'm not seeing anything popping up, so I'm going to carry on. I am just going to mention, I understand that some of this information can be quite sensitive and difficult to hear, especially those that may have someone in your life that is living with dementia. But as my role as an educator, I am not to sugarcoat any of this information because it is important for you to have the best knowledge so that you are capable and prepared to deal with this disorder to the best of your abilities. So next, we're going to cover the most common symptoms that you will find in dementia. First and foremost is memory loss. So people living with memory loss, or people living with dementia that experience memory loss, will lose their most recent information, dates, or events first. And oftentimes memory aids such as Post-it notes are useful to help individuals with this short-term memory loss. So for example, reminders on the fridge about important dates and times, or perhaps labeling cupboards to explain what may be stored behind them, such as plates, cutlery, that sort of thing. In order for memory loss to be of concern, it has to be more than what is accompanied by typical age-related change. So it has to be significant enough to impact day-to-day living, which leads us to our next most common symptom. So difficulty with day-to-day routine tasks, which is those in which could have been completed with ease prior to the onset of dementia. So for example, washing dishes, bathing, or getting dressed. The progressive decline in ability can be very difficult for people living with dementia as they increasingly need more assistance managing these tasks. And this may be one of the symptoms that causes them to socially isolate themselves, which is the next most common symptom. So as individuals become increasingly more dependent on others, they tend to isolate themselves from friends, family, and coworkers. Communication issues, such as the inability to converse or follow a conversation, is often accompanied by avoidance. So for example, I'm sure that all of us here have had moments where you have had to ask somebody to re-explain themselves 2 or 3 times before you just kind of go, and you agree and you move on with the conversation despite knowing what was actually being said. Now imagine that this is happening to you on a consistent basis. So that is what is happening with people living with dementia, and that inability to understand what is taking place in the communication causes them to fall back and isolate themselves rather than continuously ask for further information. You may also find that they are repeatedly asking the same questions throughout the day, even if the answer was given to them earlier. So this symptom is called repetitive questioning. Here, there's no need to remind the individual that this conversation has already taken place, as this is likely to add anxiety or stress that they are likely to already be feeling. Our rule of thumb is no harm, no foul. And this can be applied to many of these symptoms. A lot of the time, it is actually the care providers or family members who are more agitated by the symptoms rather than the person living with dementia themselves. So it's important to not try and fixate on these symptoms ourselves, because they cannot help that these are present, and therefore addressing them in a concerning manner is only going to add stress to the person living with dementia. The next common symptom is difficulty in speaking and writing. So they will have various difficulties with the use of language. Typical age-related symptoms may involve not knowing a word and it being on the tip of your tongue, or perhaps going to complete an activity and forgetting what you were going to do, such as I know I have done it, as well as plenty of you, I'm sure, have done it, where you go downstairs to complete a task, and once you reach the bottom of the stairs, you have no idea what you went down there for in the first place. This is not typically concerning because we have the ability to eventually recall what it was that we were either trying to say or do. However, people living with dementia will have no recall ability. They also will tend to use word substitution. So if they don't remember the exact word that they are trying to say, they will substitute words for it. So for example, if you are wearing a watch and a person living with dementia comments on it, they may refer to your watch as a wrist clock. Again, there's no need to correct them on this. If you are able to understand what they are saying, correcting them will not be beneficial. Instead, you can acknowledge it and then move on. So instead of saying, no, this is a watch, you can just say, oh, thank you. I got this as a gift. Simple enough, you acknowledged what they were trying to say, and it allows the conversation to move forward. The next most common symptom would be confusion and disorientation. What I mean by this is that the person living with dementia may become confused while navigating regular routes. So something like trying to find the washroom in the house, or perhaps in the early stages, getting lost on their way to work. They may also lose track of the time of day, the date, or what the season is. A normal state of confusion may include forgetting the day of the week, but again, it's the ability to recall this information that separates normal from a possible symptom of dementia. Next, we have impaired judgment. So the impaired judgment refers to doing something out of character. So the person living with dementia will often display changes in judgment and decision-making as the dementia progresses. These lapses of judgment are more extreme than normal bad decisions. So for example, they may leave their house in the winter time in only a t-shirt, or they may injure themselves and not recognize the need for medical treatment. And the last most common symptom that we are going to go over is hallucinations and paranoia. And as I mentioned earlier, this is most likely to be present in Lewy body dementia. And they are most likely to have visions of people, children, or animals when they are hallucinating. Most of the time, these visions are harmless, and reality checking, which is exactly as it sounds, attempting to convince the person of the reality that you are experiencing. Reality checking should be avoided. Instead of reality checking and potentially causing increased fear or anxiety, you could join their reality. If the visions they are experiencing are harmful to the individual, you may join their reality to prevent further harmful visions. And you may have to get creative when doing this. So for example, we had a client that was living in long-term care, and every evening around the same time, he experienced hallucinations of bats flying around his room. And it caused him lots of stress and anxiety. And what the care provider ended up doing was filling up a spray bottle with water and writing the words bat repellent on it and giving the client this bottle. And every time that he had these hallucinations of bats, he sprayed his bottle and the bats disappeared. So yeah, are there any questions about these most common symptoms that may be experienced by a person living with dementia? All right, I'm not seeing anything, so I'm going to continue
Just
on.
one, actually,
Oh.
there's just a couple of comments to share.
Okay.
So Gord has said, very informative video. I think everyone agrees it is a really great overview for us. And so the next comment is, statistically speaking, what is the hereditary rate of Alzheimer's being passed down? The video said 1 in 10. However, what was this rate in families, or is there no logic to who can get it?
Yes, so there is no logic as to how an individual develops this disease. As I had mentioned earlier, there is no genetic component found that 100% confirms that you will develop dementia. The only genetic component that is available is a tiny, so out of all the hundreds of types of dementia, there's only a genetic component found in young onset dementia, which makes up roughly 2 to 8% of dementia cases. And within that specific dementia, there's only a 3% chance that you inherit the genetic component. And even then, it is not a surefire guarantee that you will develop that same dementia. So the genetic component is very minuscule, and we don't consider it to be a guarantee onset to dementia.
All right, thank you for that. We also have another question.
Okay.
So when should you begin to be concerned that this is now serious? At what symptom stage?
Mm-hmm. That's a great question. Thank you. We typically recommend that when the symptoms, so these most common symptoms that I've just gone over, when they start to impact the person's ability to perform day-to-day functions, so those that are usually done with ease, such as eating or bathing or recalling specific events or times, when those day-to-day tasks become impaired, that's when it may be concerning, and you can go to your family doctor for a potential diagnosis.
All right, thank you for that. There's one more question. So that last question, I want to give credit to Lori Beddick. So that was a great question. Now, Lorraine Gilmet also has a question. Can a person skip stages, for example, have memory loss and repetitive questioning, but still able to perform daily tasks?
That's a great question. Thank you. So yes, with dementia, the symptoms that a person is going to experience, you will not find that there are two alike journeys. So the journey of dementia will be specific to the individual, and we cannot know what they might experience and when. It is just, all we know is that it will progress and eventually get worse.
All right, we have another comment as well. I have to say, this is the most participatory group we've had, Ava. So
this is awesome.
Yeah. From Lacha Hives, very informative, Ava, and helpful that you are giving scenarios and strategies. So that's a thank you to you. Emma has a question. When symptoms are noted, do you happen to know how people receive referrals to the appropriate professionals, such as speech, language, occupational therapists, physiotherapists, etc.?
Mm-hmm. Yes, another great question. We will cover this a little bit further down in the presentation, but just quickly, when you do become concerned about the symptoms that they are experiencing, you do start with your family doctor, who will perform multiple different tests to give the diagnosis of dementia. And then from there, you seek out a specialist that is particular to the dementia that the individual is experiencing, as well as then you can approach your local Alzheimer's Society. A referral is not needed to come to us. And most of the times referrals are not needed for our programs and services either.
Great, thank you for that. I just want to mention that Ava's doing another presentation tomorrow at 10:30 to 11 on brain and behavior, and is also part of our panel that's happening this afternoon from 1 to 2:30 about aging at home supports, which will talk a little bit about how the Alzheimer's Society supports people living in their homes.
And I do apologize. I know that we are going over time, so that if anybody feels the need, they have to step out. I completely understand.
Yeah, we have about 15 minutes left, so you're doing okay.
All right. Okay, so if that's it, then I will move on. So next we are going to go over treatable conditions. So there are conditions that mimic dementia symptoms. However, these can be treated. And so this is why it is important to go to your family doctor so that they can make sure that these aren't what you're experiencing versus dementia. So first there is depression, and this mimics symptoms of dementia, including feeling lethargic, sad, and experiencing a loss of interest. Then we can move on to infection delirium. And this describes a state of disturbed mind characterized by restlessness, illusions, and incoherent thought and speech. In dementia, these symptoms are prolonged, whereas those experiencing infection delirium may only experience these symptoms for an onset of a few hours or days. And it is actually often caused by an untreated urinary tract infection. An individual may also be experiencing medication side effects. So I'm not sure about you, but I have a really bad habit about not reading the side effects on medications or supplements that I take. And actually many side effects of medication misuse is temporary dementia. Next, there are metabolic disorders that can cause dementia-like symptoms. So for example, dehydration can lead to confusion. Kidney disease can cause trouble with concentration and sleeping, etc. There are also hearing impairment or vision impairment. So if the individual is experiencing symptoms along those lines, it would be vital for you to take them in to those specific facilities to get their hearing checked or their vision checked. There is also sleep disorders, which sleep deprivation can cause concentration and coordination irritability, and of course lethargy. You can also look at nutritional disorders or deficiencies, such as vitamin B12 deficiency, which is often accompanied by extreme tiredness and mobility issues. And then also other concussions exist, other conditions exist, including concussions or tumors, problems with your thyroid glands. All of these could produce conditions or symptoms that are comparable to dementia. So, like I said, because of this, you want to make sure that you are getting assessed by your family doctor. So the process of getting a diagnosis of dementia is not meant to be easy, and it can become actually quite complicated. So the key to the most straightforward diagnostic process is providing good communication while communicating your experiences to your family doctor. So the first step is receiving a full examination by your doctor to rule out any other possible causes of symptoms. There is no single test that can tell whether a person is living with dementia. So a doctor is likely to conduct lots of different tests, such as medical history, physical exams, blood tests, brain scans, to make sure that they can exclude other symptoms, such as the treatable conditions mentioned in the previous slide. The second step is to connect with the local Alzheimer's Society. We have a position called the First Link Care Navigators, which carry out additional mental assessments that, accompanied with the doctor's assessment, is used to determine the stage that the person living with dementia is in, as well as the appropriate next steps for this individual. And this awareness can help slow the progression and ensure that the person living with dementia lives well, because they will then have the adequate resources that they need to ensure that proper care is provided. The third step involves a referral to a specialist. So a specialist will be able to provide information for the specific type of dementia that the individual is living with. As we mentioned earlier, dementia is considered an umbrella term, such as cancer. So an individual, say, living with lung cancer would not seek a specialist for skin cancer. So you can think of it the same way in dementia cases. And the fourth step involves making a care plan. And it is important that this is done with the entire care team. So this would include the caregiver, the family doctor, the First Link Care Navigator with the Alzheimer's Society, the specialist that you are referred to, and anyone else who may be important to that individual's care team. This process will not be easy, and having adequate support for both the care provider as well as the person living with dementia will be necessary. There are steps that we can take to ensure that we preserve a healthy brain and perhaps slow the progression of dementia. And we are going to go over that in this slide. So when speaking of dementia, it is important to note that this disease does not discriminate. There is no one class of people over the other that will experience this disease more so than others. However, all individuals can incorporate the following brain healthy activities into their daily routines to help lower our risk factors. So first and foremost, our rule of thumb is what is heart healthy is brain healthy. We want to make sure that we remain physically active and that we adjust exercise to the individual's capabilities. If you don't lose it, you will lose it. We also want to make sure that we are eating a healthy diet. If you eat good, you'll feel good. You want to make sure that you remain socially active. It is imperative to remain socially active so that your brain center and your language communication stays stimulated. And you also want to continue exercising your brain so that this area of the brain also remains stimulated and is challenged. So this includes things such as reading, completing crosswords or Sudoku, perhaps trying to learn new things such as a card game or knitting, but it can actually also be much simpler than that. So for example, if you brush your teeth or comb your hair with your right hand, it can be as simple as switching to your left hand to ignite a different area of the brain. So within the care plan, these brain healthy activities can be used to mitigate symptoms of dementia. And it is also important to incorporate person-centered activities that emphasize the person living with dementia's current strengths so that this can improve their quality of life. Next, we're going to go over changes in communication. This is one of the largest barriers of dementia. It has a profound effect on the language abilities, and this is known as aphasia. So individuals with aphasia experience difficulty in expressing themselves, understanding spoken language, and finding the right words in reading and writing. As dementia progresses, the person with dementia may create new words for those that have been forgotten. They may repeat or get stuck on a certain word or phrase. They may begin to curse more often or use offensive language, and they will lose their train of their thought more often. They may also lose the physical ability to make their speech understandable. This is often seen in the more later stages, as well as they may revert to their mother tongue. So if they grew up speaking French and only learned a second language halfway through their life, they may actually revert back to their French language, which may seem concerning for those around them. The person living with dementia may experience difficulties interpreting facial expressions, understanding abstract concepts, organizing logical sentences, or understanding humor or jokes. So all of these changes can be upsetting and frustrating for the person living with dementia, as well as those around them. But as the disease progresses, nonverbal communication is going to become increasingly important, because despite the changes in their communication abilities, communication will remain possible at each stage of dementia. So we are actually just going to look at the communication breakdown. There are three main categories needed for effective communication, and this is words, tone of voice, and body language. It's important to recognize that while the words you speak may stay the same, your tone of voice and body language is going to change the perception of the message you are trying to deliver. So I have a very quick example. If I was having a great day at work and I sent a great big long message to somebody explaining this, and all they responded with was a text saying this, I am likely going to assume that that individual is not interested in my exciting news, and I may become offended, and yeah, I may become unhappy and offended. However, if I am having a phone conversation with them and their tone of voice is included, I might be able to understand the message that they are trying to give to me. So for example, I share this news with them, and then all I get is the response of them saying, "Nice." I am going to be able to pick up on that tone of voice and understand that they are engaged with the information I am sharing. And finally, if we are in person-to-person conversation, I can hear their words, I can hear their tone of voice, and I can see their body language, and I have delivered this great news to them, and they respond with, "Nice." And I can see that they are excited about this information with me. I'm going to feel much better about the conversation and communication overall. So appropriate expressions and physical gestures are going to improve the person living with dementia's understanding of communication. So we do have a few communication strategies to enhance the success of communication with people living with dementia. So before using verbal communication, there are multiple things to consider. You need to make sure that you approach the person living with dementia from the front, because oftentimes their peripheral vision is going to be impacted, and approaching from somewhere else may startle that individual. Also, you should find a quiet place with good lighting and minimal distractions to gain their attention. You also want to make sure that you maintain eye contact during the conversation and display yourself with an open body language to display yourself as a trustworthy person who is engaged. And this will make the person living with dementia feel invited and feel like they are engaging in effective communication. You want to create a safe space for the individual where they feel comfortable, otherwise they may not engage. And this includes spending adequate time with them so that they do not feel like the communication is being rushed and they feel like you are actually wanting to engage with them. When you speak, your words should be expressed clearly and calmly with one idea at a time. Your question should be stated simply and with options so that choices are not unlimited and then their response doesn't seem confusing or overwhelming. You want to speak to them as adults. Baby talk is not acceptable. They are still adult human beings. You want to give them adequate time to respond. A person living with dementia's brain is going to take more time to process words. And you're going to want to use physical cues for assistance. So example, if you ask them if they want a drink of water, you can hold up a glass of water and ask them, would you like water? And they are much more likely to understand what you are trying to get across. And also, when you are speaking to the person living with dementia, you want to make sure that you identify yourself by your first name. So you should not assume that the person living with dementia will know who you are, and using your first name will reduce the likelihood of confusion or insecurity they may have about who you are approaching them. If they do not understand your conversation cues at first, try rephrasing what you are saying instead of repeating the same thing over and over again, as this is only going to cause frustration for both you and the person living with dementia. You want to avoid reality checking, as this can lead to fear and anxiety, and instead join them in their reality and create a comfort and safety. And once that is completed, then you can redirect them. So for example, if somebody is experiencing a hallucination and believes they see a little girl in the room, you can acknowledge that little girl, say, oh, tell her I say hi. Would you like to come make lunch with me? So you acknowledge the situation and then you redirect them to a different activity. Similarly, you want to avoid quizzing, because comments such as, don't you remember me, are not going to be helpful to the person living with dementia, because they won't be able to find the answer and they will just become confused and frustrated. Also, listen with your eyes and acknowledge their emotions and behavior. Lastly, laughter is the best medicine. So as long as you are remaining sensitive and respectful of the person living with dementia, it is okay and actually beneficial to use humor to stay light about misunderstandings and mistakes. So before I move on to our programs and services that we offer, I just want to make sure that there are no questions out there regarding the effective communication strategies.
I'm wondering, Ava, can you give us an approximate time check about how long is left so that participants can gauge whether or not they can continue?
Yes, for sure. The programs and services probably won't take any more than 5 minutes.
And that's the end?
Yeah.
Okay, great. Thank you for everybody's patience. Such important information. So keep going. Don't stop.
Okay, great. So I am just going to quickly review the program and services that we offer here at the Alzheimer's Society. So we offer various clinical services, education and health promotion services, which is me, and our day program Health Bistro. So as we mentioned, we have the First Link Care Navigation, and they provide the services to the individual from the start of the diagnosis all the way to the end of life. And then they also help care providers and families move on after that end of life stage. So they make sure that they refer you to the adequate services that not only we offer at the Alzheimer's Society, but also what is offered in your community. The First Link Care Navigators also provide cognitive assessments. As we mentioned, these are used with the assessment that the doctor provides, and in order to perform in order to create a treatment plan. We also have behavioral supports. So these facilitators help care partners who are struggling with persons living with dementia who are experiencing lots of behavioral responses, and they will come in and observe these behavioral responses and then provide advice as to how you may be able to handle those responses more effectively. And we also have a various amount of support groups. So support groups, we offer various different types for families and those living with dementia. And so these are used to help individuals share personal experiences, increase social networks, and it can help increase the feelings of self-worth and control over this disorder. They're all led by trained facilitators, and members often experience emotional relief and are better able to not only help the person living with dementia, but also cope themselves more effectively. We have, under our education and health promotion, we have various programs aimed to encourage healthy physical, mental, and emotional well-being, and they are provided for both the person living with dementia as well as their care partners, and as well as community members or first responders, general public, anyone who is looking for more information on dementia. We also have the Learning Series, which is probably it's our most common education series, because when you are referred to our society, to our First Link Care Navigators, this is the first program that they are going to suggest that you take. It is a 4-week education series that covers topics such as an overview on dementia, effective communication, coping skills, and community resources. We also offer things such as in-home activation kits. So these are kits that are made so that people living with dementia can do activities in their home environment, and they are made based on their individual personhood. And they include activities that can be performed both by the individual themselves and also between the person living with dementia and their care providers. We provide recreational therapy, and they assist the individual in his or her recreational pursuits by adapting previously enjoyed activities or introducing new ones that match the individual's current capabilities. And then we also offer health promotion programs. And these health promotion programs encourage physical, mental, and emotional well-being. And our most common one is the Minds in Motion program, which we are currently running both virtual and in person. It's our only one that is being offered in person right now due to COVID restrictions. And it incorporates both physical activity and mental stimulation. And it is designed for the person living with dementia to attend alongside with their care partner, but it is facilitated by a trained individual, so that the care provider, although they are there participating in the activities, they also experience a form of respite. We do offer other health promotion programs, but unfortunately none of them are running right now due to COVID. And lastly, we have our day program, Health Bistro. And so what this is it's offered for those with the primary diagnosis of Alzheimer's disease or related dementias. And it offers supervised activities in a home-like setting under the direction of our professional staff members. And they offer meaningful activities and personal care while respecting the individual's life history and cultural and spiritual beliefs. So again, this is a form of respite for the care providers as they are able to drop the person living with dementia off at our day program, and they are looked after by our staff until they are picked up at the end of the day. So yeah, that was a very brief overview, but if you have any questions about more of our programs and services, feel free to reach out to me and I can provide that to you.
Thank you so much, Ava. We actually have a few comments that I'd like to go through in questions.
Okay.
So Desiree is in West Nipissing, so we're going to give West Nipissing a shout out. We have some participants from West Nipissing, and one of their clients has a question. Can Alzheimer's cause someone to have a brain aneurysm?
So Alzheimer's would not cause the individual to have a brain aneurysm, but it could almost be reversed, is where the brain aneurysm may actually increase the individual's Alzheimer's symptoms.
The next question is from Nikki Sage. Is there a link between brain injury and dementia? And can you share any resources you have on that?
Okay, so brain injury is typically related to vascular dementia because this is when the brain is injured, there is a lack of blood supply to the brain that eventually leads to cell termination. Vascular dementia specific resources I may have to look into and get back to you, but for now I can let you know that yes, brain injury, although it doesn't cause that dementia, you are more likely to get it if you have had a significant brain injury.
Okay. So another question from Lacha Hives. I appreciate how you were referring to the person living with dementia. And I think that's language you want to encourage. It's very respectful, right?
Mm-hmm.
So the alternate is somebody isn't the disorder, you know, somebody
exactly
isn't demented, right? Like they,
yes,
they are a
we
person.
want to make sure that they are still acknowledged as human beings. And so they are a person living with dementia and they are not a person with, that you don't want to categorize them by their disease.
I think we could, you know, do that with people who have even diabetes or any kind of,
exactly.
Yeah. So the next is from Emma. This is covered so thoroughly. Nikki, this is great information. It is so beneficial. So Emma makes a comment. It's so beneficial to have speech therapy services to address these concerns around that you were mentioning, I think, around communication. And then again, from, I think it's Sherry, I'm trying to see the names. What a great presentation. Thank you. Now, Susan Preeb has a question. At what point would a person living alone with no caretaker need nursing home care?
That's a good question, and it is a difficult one because it is up to the individual and the people in their life to make that decision. There is no kind of cutoff line where you have these symptoms, so now you should be in long-term care, but it is more so towards the middle to late stages that when an individual is needing 24-hour care, that they typically look at entering into a long-term care home, but it is more directed towards the individual living with dementia as well as their care provider as to the extent of how much they think that they are willing to provide that individual.
All right, so another question. Does our local Alzheimer's Society partner with local allied health professionals to ensure that people living with dementia and care providers have access to well-researched, meaningful, and functional treatment options related to the specific concerns, symptoms, and goals?
Actually, yes, that is another great question. So our First Link Care Navigators, they are well connected with lots of different health resources throughout the communities. And if they believe that their client would benefit from another resource, they will recommend that they seek out that service.
Okay. Another thank you to you, Ava. Thank you for the super informative presentation. I learned multiple things and a few tricks, new tricks to help with my future interactions with families who are navigating this relentless illness. Your passion shows on your desire to educate. That's from Gord. And then Nikki has a question. Can we share the resources with family caregivers? So for the resources you've shared, are we able to share those as well?
So the resources I've provided, they're asking permission to be able to? Of course, absolutely. And if you are interested in further education, feel free to reach out and I can provide you with an education request form.
Oh, sorry, I think I read that question wrong from Nikki. Okay, so she's just saying she will share the resources you provided.
Oh,
they
okay.
also have some resources as well.
That's great.
Awesome.
Knowledge is power.
Awesome. Again, thank you so much, Ava. And again, check out the schedule online to see Ava's doing another talk tomorrow around the same time. And then we have our Aging at Home panel today at 1. I encourage you to bring a friend. Invite somebody. There'll be lots of interesting information that you probably didn't even realize were supports available in our community. So once again, thank you. And thank you for those who were patient and stayed longer. Obviously, we had a big crew stay with us right to the end. So that's awesome.
Awesome. Thank you all so much for having me.